Good morning, everyone. It's 10:30, so we'll get started with today's webinar. One quick housekeeping item. A lot of you are probably tired of hearing me say it, but when you submit questions, please make sure you send those to all panelists so that everyone that's participating as a panelist can see that question, and we can ensure that the best aligned person can answer that for you. And with that said, I am going to turn it over to Jess to get us started.
Hey, good morning, everyone. Happy Friday and happy National Direct Support Professional Week. Huge thank you to all of the direct support professionals out there making an incredible difference on a daily basis. Today we have several updates for you, and I am going to go through some updates mainly from the federal level, and then you'll hear from other members of our team regarding updates on COVID and other things going on with the enhanced FMAP funds and with the program in general. And so with that, I'll get started. On September 10th, we had an announcement from the Department of Health and Human Services that there would be an additional round, $25.5 billion in provider relief funds, and those will be available to providers who have received previous rounds of relief funding. And we were excited to see that developmental disability providers were specifically mentioned in the announcement. So we sent that out as an informational email through the DD mail listserv, and we expect to have more information coming on the application process, and we'll share with all of you as soon as we are able to receive that. The next thing I wanted to talk about at the federal level is that we are closely watching the federal stimulus package and the language that is included regarding our program and those we serve. There are some things we do know and a lot we don't know, and it still has to make its way through the process. But at this point, there is a proposed $190 billion for home and community-based services and workforce in the bill. And that is as of September 9th, the information that we had. Some specific things in there that is important to mention is that there's currently $130 million for state HCBS improvement planning grants, and there is also an FMAP increase for HCBS improvements and enhanced FMAP rates. So that includes administrative costs as well, an 80% enhanced FMAP for administrative costs and a 7% increase in FMAP for states for HCBS program improvements. So we're very excited to see that in there. There are some things that are still kind of being molded at that level that we kind of keep seeing changes to as it goes through the process. But as it stood at the time we got this information, there was a 2-year increase to FMAP of 2% if states adopt an HCBS model that promotes and supports self-direction. And so that would be just, throwing an example out there, the 10% for enhanced FMAP that went through in the previous stimulus package is around $220 million. So a 2% increase would be around $44 million a year, depending on expenditures in the program annually. And that's in addition to some of the other things mentioned. So that's what we're watching right now as well. There's also a lot of specific funding around the workforce for the direct care workforce, which we are very excited to see. And that funding is specifically around creating DSP training programs, certifications, career ladders, and helping states fund the recruitment and retention strategies in order to bolster that workforce and increase DSP pay. So we will be communicating more, of course, as we get more information, but I also wanted to just talk about that status of that federal stimulus bill right now as it relates to the programs. Third thing from the federal level is that I know we are all paying attention to the announcements around vaccination requirements from the federal government. And we know some things, and there's a lot more that we don't know. What we do know at this time is there is a high level of certainty that the vaccination requirements will apply to all staff at ICF. And there is a medium level of certainty around whether those vaccination requirements will apply to the home and community-based providers in general that receive Medicaid funding, so the complete universe of providers that receive funding through our waivers. We will continue to watch that, and as the rules are written by CMS and more information is released, we will provide updated information regarding that. So more that we don't know than that what we do know, but I just wanted to make sure that we're keeping everyone updated on what we do know. So with that, I will go ahead and hand it off for the latest information on COVID to Dr. Stanislaus, and I'm so glad you could join us today, Dr. Stanislaus.
Thanks, Jess. What do we have on COVID today? So our state COVID positivity rate is about 10.6%, which is confirmed PCR. Again, this is only taking into account people who are testing. There's a significant amount of individuals who don't test as well. But overall, it's a little bit of a dip in the rate than what we were seeing a week or a couple of weeks earlier. Hospitalization rates, I think at this current time, we have close to 2,000 people in the hospital, and nearly 50% of them are in ICU or ventilator status. So we still have a significant number who are pretty sick and ill with COVID when they do get the illness. What we know with the Delta variant is also the individuals are much sicker or much younger. They get sicker quicker, and they're also younger. And we know that the majority are unvaccinated who are in the hospital. The other thing I wanted to talk about today specifically is about the monoclonal antibodies. So one of the things we found is the monoclonal antibodies have definitely made a significant improvement in COVID, mainly that it prevents progression of the COVID towards more serious illness, such as breathing difficulty and ending up in the hospital or on the ventilator. So before, so the demand for monoclonal antibodies has really gone up, really gone up. It's been always available, but more individuals and more medical professionals are using it now because we have much more clear guidelines of how to use it. So there have been more orders for monoclonal antibodies, which then means that there are more orders than availability of the medication, the monoclonal antibody overall. So some places have waiting lists. Also, until now, we were able to order the monoclonal antibodies directly from the federal government through their their Health and Human Services website. Within the last week, they have changed that into a state-based ordering system. So now the only way you can order it is through a website through DHSS, and I think Mike Heike just put it on the chat. Was it in the chat, Micah? Let me see. So there is a new there's a new ordering system through which is the only way you can order it right now. So if you have, I think there is a link that I asked Heike to put in here, but if you have any questions or questions about this, how to order, or you're having difficulty how to order, or there's some confusion, please reach out to me. Monoclonal antibodies have made a huge difference. I can tell you that we have one client when in one of our community, state-operated community programs, and he was very sick, but we managed to get him. The moment he was very sick, was hospitalized a day ago. But just before he was hospitalized, we had, within day 3 or 4, we had actually given him the monoclonal antibody infusion, and he was very sick the day he was hospitalized. And then we got news yesterday saying he is doing much better. And I do believe that the monoclonal antibodies did help with the speedy recovery. So it makes a huge impact. So talk to anybody you know, or any of the residents who are whether vaccinated or unvaccinated. If they test positive for COVID, please do contact the medical professionals and ask about monoclonal antibody infusion. There are several infusion centers set up around the state. And also the local hospitals are also providing monoclonal antibodies. But if you have any difficulty getting it, or you don't know where to get it, or there are issues, reach out to us and we will connect you with the right individuals. I don't believe, now we talked about COVID. We talked about a COVID where the infection is the highest. Southwest rates are coming down, but Southeast right now is the hotspot. So that they found the highest rate in New Madrid County, which is Southeast Missouri. The rate was 39%. So 39% positive of all those individuals. So 100 people get tested for COVID with PCR, about 39 came out positive. That's a very high rate. So it's mainly the Southeast region that is currently the hotspot. So the facilities in the Southeast region, if you are having staff and if you want to do screening, more screening, testing, screening for symptoms, testing, screening for exposure, just be a little bit more vigilant. And again, any questions that I can answer or any help DMH can provide, we'll be glad to do so. That's all I have. And now I would hand it over to Station MD, Dr. Trivedi. I believe you're next.
Great. Hi. Can you guys hear me okay? Great. Thanks. Thank you so much. I just had a brief kind of a presentation. I wanted to just talk to everyone about the process, because we did have some questions about how the process of starting Station MD and utilizing Station MD works, because there was just some confusion about that. And just to let everyone know, not to sound like a broken record, but we are still there for your medical questions, concerns, including the questions about monoclonal antibodies, but of course, any medical issue. So if I can share my screen here, let's see. I just have a brief video that kind of shows how our services work. Can you guys see that? Yep. Okay, great. And hopefully you'll be able to hear it, but let me just show you. It's a minute long.
Station MD doctors are available 24/7 for any issues such as fevers, falls, medication refills, behavioral outbursts, and any other questions that you may have. Nothing is too small to call for. Here's how to start a telemedicine visit using the Station MD app. First, if you haven't already, download the Station MD app from the Google Play or Apple App Store. Next, open the app by tapping on the icon on the home screen. Next, accept both the terms of use as well as the consent agreements. Now enter in a name. This can be the name of the caretaker or the support staff that is using the app. Next, let's start a telemedicine visit by tapping on Add Site. To get a mobile app token, you will need to call Station MD first. Now enter in the mobile app token or use the QR code that you received. That's it. You're all set. Now you just need to wait for the doctor to start the visit. Remember, call Station MD, enter the mobile app token, see the doctor.
Okay. Not the most riveting video you've seen, I'm sure, but we've tried to make it as simple as possible. And again, we just want to let you all know that we are there as a resource for you regarding any medical concern, whether it's COVID or not. I do want to add that although it is quite simple to use, every call that we have is facilitated by what we call a navigator. So they can kind of walk you through if there's, question about the microphone or video or anything like that. That's really all I had, and I'm not sure who is next. So thank you.
That's okay. Thank you so much, Dr. Trivedi. And I just wanted to say that is such a simple thing to do, and I love that this service is available to our clients and our families and our caregivers. And just to prove to you, while that video was playing, I downloaded it on my phone and opened it up, and it's all ready to go. So really love the service. So thank you again for being here with us today. And Heike, I will let you take it from here. I have to jump off for another meeting, but it was wonderful to see everyone, and have a great Friday.
Bye-bye.
Thank you so much. Leslie Bradley, I think we are ready for you for a Connect-A-Thon update.
Thanks, Heike. Okay, September 13th through the 15th was the HL7 Fire Connect-A-Thon. This is an international online event where healthcare and electronic data solution organizations come together to learn, test, and demonstrate electronic health record data exchange capabilities. It was an exciting time for the Missouri DD team and the pilot demonstration work group because it was our LEAP grant's midpoint demonstration. The team tested and demonstrated the interoperability of the electronic individual support plan completed by a case management provider, which was successfully exchanged to a primary care and supported employment service provider. The IT vendors who participated and providers that were included were the Division of DD, FEI, Patient-Centric Solutions, Station MD, who we just heard from, Boone County Family Resources, Impact, Employment Solutions, and SetWorks. It was a very successful demonstration, and there were a lot of beneficial lessons learned, and all of this will be shared with stakeholders in November. And something that's really exciting is Missouri is the first state in the nation to test and demonstrate the interoperability of the electronic ISP for recipients of Medicaid waiver, home and community-based services. And just for everybody's information, the LEAP grant is funded through the Office of the National Coordinator of Health IT, located within the U.S. Department of Health and Human Services. So with that update, I'm going to turn it over to Emily Lubering. Emily?
Hi, good morning, everybody. I have a quick update on the submission of a addendum to Appendix K. The federal program is working with CMS on a submission of draft language for the addendum to increase individual supported living and group home service rates to 100% of the lower bound rate. And this is in accordance with the approved rate methodology in our waivers. This rate increase utilizes the 10% point increase in the FMAP for individual supported living and group home Medicaid expenditures through the Home and Community-Based Services. And this is part of the American Rescue Plan Act of 2021. Also included in that addendum is increased funding for personal assistant provider rates by 5.29%, and this is in accordance with the approved rate methodology also in our waiver applications. And this rate increase utilizes the temporary 10% point increase in FMAP as well. This proposed, the effective date for both of these to begin funding would be 7/1 of 2021 through 6/30 of 2022. So we're currently working with CMS now to have this, work with them on the language for this addendum to get it approved and in effect. That is all I have for the FPU unit. And I will hand it off to Leslie DeGroot if she's on today.
Yes, thank you, Emily. Good morning. My name is Leslie DeGroot, and I am your division's clinical coordinator. I'm happy to be joining you this morning. My update for you is about our COVID-19 information and resource messaging to individuals, families, and caregivers. In partnership with the University of Missouri, Kansas City Institute for Human Development, we created a COVID-19 informational toolkit. And I'd like to show you how to get to it on our website, and then I'll post the link in the chat. So I'm going to steal the, oh, I have the folder. All right, I'm going to share my screen. And I hope that you guys will check this out and be able to use it to look for resources. Can you guys see my screen? Okay, I'll just walk you through how to get there. You click on, this is the DMH website, and you go to our Developmental Disabilities page. And then you just click on this COVID-19, how it pops up there, and then you go under individuals and families and scroll down just a little bit, and it's this top link right here, COVID-19 information and resources. So I'm going to bring up what it looks like so you guys can kind of get, look at it. It's got links on it. Let's see here, excuse me, got to move some stuff around on my screen. So there are video shorts or storyboards, phone numbers, and email addresses with a description by each so the individuals, families, and caregivers can get the information in the manner that is best suited for them. See, this is general information up here. Right here is where it has the numbers that you can call on the website, Mo Stops COVID. And then there's the email address, which I think is very nice because a lot of people do like to email. And then here we have videos and other materials that might be easier for people to look at, to understand and learn about, like getting the vaccine and signs and symptoms of COVID and testing. Here we have UMKC Back to Basics video that highlights the importance of individualized support planning and choice, because we just want to offer all the good, incredible information that's out there so that people can make their own informed choices and stay safe during the pandemic. And down here we have resources on finding a vaccine, that you can find out how to get a ride to get a vaccine if you need to. Other things from the Department of Health and Senior Services on COVID testing, Station MD services, there's the link there. And UMKC IHD planning and problem solving using Charting the Life course tools and concepts. And they have many just different things that you can look at and information about coping with the pandemic. It's just very, I just hope you all will check it out. We hosted 2 separate webinars in order to share this toolkit. One was with the service coordinators as our target audience so that they have the toolkit to be able to share with individuals, families, and caregivers. And then the other webinar we held was for individuals, families, and caregivers as our target audience to let them know that this is out there. And we're also going to post the webinars, questions, and answers onto our website. So I'm going to drop, well, maybe I'm going to try to drop that link in the chat so you guys can, if you need to, want to access it. All right, I'll do that before this meeting's up. I'm not able to copy it. One last thing though that I also would like to bring up, just to get the message out there. September is Suicide Prevention and Awareness Month, and we have resources on the DMH website for getting help. So just, please look out for each other and look after your own mental health, and don't hesitate to reach out for help. Everyone's important and not alone. And so I'm going to also post resource link and also the National Suicide Prevention Lifeline and the Missouri Crisis text line into the chat for your reference. And thank you for your time today, and I appreciate you listening. And I'm going to stop sharing, and I'd like to hand the ball over to Wendy Witzig.
Good morning, everybody. I just have a quick couple things for you, and then we'll give you some time back in your day. First off, I wanted to give a big thank you to everyone who joined the Q&A on the support coordination monitoring guidance. That was this past Wednesday. We had 248 participants, which was much more than I was expecting. And we had 45 minutes of really great questions. Got a lot of feedback that it was useful and appreciated. So we're going to make a webinar Q&A a more regular occurrence when we're putting out new guidance. Your questions give us perspective, and they really do help us to write better guidance. So thanks again to everyone who attended and was asking questions. And then just to let you know that effective September 13th, the expedited UR process is back in place for COVID-related requests. It'll follow the same process and the full guide as was out before and as we've used before, and the full guidance can be found on the division's COVID website. This guidance has been out there for a while, and so I don't know if there's any value in a Q&A webinar on this particular piece. So I'm going to put it to you guys on the call. Please type in yes in the chat if you would like for Neil to host a Q&A on that guidance, and we'll give you just a couple minutes to type that in, and that's really all I have. Leslie has put in the chat here the National Suicide Prevention line and the Missouri Crisis Call text line. This is Suicide Awareness Month as well as DSP Appreciation Month. So thank you to all of the direct support professionals that are out there doing your work. We appreciate you. We know that you've got an extremely challenging and tough job, and we just appreciate everything you do. So I hope that you get lots of recognition and appreciation throughout the month. And that's all I have. I see a couple of yeses on the Q&A there, so I'm going to leave it open another minute or so, and if you want, otherwise you can sign off, and you have a wonderful weekend. There's another question that popped up for those that are on. Is the remote monitoring for service coordination continuing past September 30th? I don't think that decision has been made yet, but we will put that out in a blast once we have that information. Thanks for the question. Have a good weekend.